Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. How long does it take for Rybelsus to start working? Rybelsus is started at a lower than effective dose to reduce the risk of side effects, which means benefits will not be seen until the dose is increased to 7 mg. The dose is increased from 3 mg to 7 mg after 30 days, so you can expect Rybelsus to start showing an effect from day 31 onward. Every time you increase the dose of Rybelsus, it takes 4 to 5 weeks for steady levels to be reached, so it may take 2 to 3 months before the full effects of Rybelsus are seen. Some people may require 14 mg of Rybelsus for it to be effective. Rybelsus, semaglutide, is an oral medicine that is used to improve blood sugar control in adults over the age of 18 with type 2 diabetes. It should be used along with diet and exercise. Rybelsus is best taken on an empty stomach when you first wake up, at least 30 minutes before food, and with a small amount of water, no more than 4 ounces. This ensures Rybelsus is absorbed properly. After 30 minutes of taking the tablet, you may eat, drink or take other oral medicines. Rybelsus needs to be started slowly at 3 mg once a day. Starting at a lower dosage helps your body to get used to taking the medicine and reduces the risk of digestive side effects, such as nausea, belly pain, diarrhea, decreased appetite, vomiting, and constipation. This low dose is taken for 30 days and it is not effective at lowering blood sugar. After 30 days of taking Rybelsus 3 mg a day, your doctor will increase the dose to 7 mg once a day. This dose is usually effective at lowering blood sugar levels and may be increased to 14 mg a day after 30 days if well tolerated and further blood sugar lowering is desired. Taking 2 7 mg tablets to achieve a 14 mg dose is not recommended. Because Rybelsus is started slowly, at a lower than effective dose, it won't start working properly until the dose is increased to at least 7 mg, which is done after 30 days of taking 3 mg. So it takes at least 31 days before it is effective. Related questions: Tirzepatide versus semaglutide, how do they compare? How does semaglutide work for weight loss? Why am I not losing weight on Ozempic? How is Rybelsus able to be given orally? Rybelsus tablets are formulated with salcaprozoate, which is an absorption promoter. Salcaprozoate helps poorly soluble large molecules, such as semaglutide, but also others such as insulin or heparin, to be absorbed, offering a more convenient way for medications to be taken that are typically given by injection. The absorption of Rybelsus primarily occurs in the stomach, but only up to 1% of the dose is absorbed, which is why it is important to take it on an empty stomach. After one dose of Rybelsus, maximum concentrations of semaglutide are reached 1 hour after administration. After 4 to 5 weeks of regular dosing, blood levels of semaglutide have reached steady state. This means they remain constant in the blood and don't fluctuate up and down. Semaglutide lasts a long time in the body, about 4 to 5 weeks after the last dose. Clinical studies have shown. After 26 weeks, 69% of people taking Rybelsus 7 mg achieved an A1C of less than 7% compared to 77% of patients taking Rybelsus 14 mg and only 31% of patients taking placebo, a pretend pill. Fasting plasma glucose levels also decreased by 28 in people taking Rybelsus 7 mg, by 33 in people taking Rybelsus 14 mg and only 3 in people taking placebo. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.